So scoliosis is a three-dimensional spinal deformity. It's important that you recognize these three dimensions, and it cannot be fixed with exercises which is only working in one dimension or even two. These are from the Weinstein Natural History of Scoliosis book, just showing what kind of curvatures the patients may be hiding under the t-shirts when they show up for your gym exercises or group exercises. It's important that you recognize some of the signs and symptoms even when they have a t-shirt on, for example, uneven shoulders, uneven pelvis, and maybe the head position is not in center. So the most common curvatures are listed here. Of course, there are many other combinations could be present. How do we test for that? It's for the Adams forward bending test. The patient or your client bends forward and you see an unevenness on the thorax. And usually where the thoracic rib hump is present, that's where the curvature is going. If there's a lumbar curvature lower back, there's also prominence there. You can also see on the left side that not just the patient who's examined has hyperkyphosis, but probably the examiner as well on this pamphlet. So the hyperkyphosis could be tested by looking at the person on a lateral or a side view, and you can see a little bit of a steeper bending on a part of the area where the hyperkyphosis happens, most commonly on the upper part, but it can happen in the middle and the lower part as well. How do we test for scoliosis? How do we screen for it? We use a scoliometer, which is really a leveler. It will show higher and lower part of the upper back. And if the scoliometer hits between 5 and 7 degrees, you should refer those clients to a professional. You can use a phone, a smartphone. You can use a smartphone app. There are many of them available now to measure scoliosis or screen the scoliosis and measure the angle of trunk rotation. This is the rotation of the rib cage, and we assume that is a consequence of the scoliotic deformity. So check your clients. It takes 30 seconds. You can learn how to screen. You can learn it on this platform or any other platforms. And it's important that you check the spinal measurements of your clients before you start engaging them to any physical activities or exercises. Just to let you know, teenagers are treated by brace treatment full time. So it's important if you do have a young person under your care, walks into your gym or wants to do some exercises and you notice there's a scoliosis present and this individual still has a lot of growth left, you definitely have to refer this individual to a professional. Otherwise, you might see some progression in this case, and you have to prevent it. And the evidence-based treatment for preventing scoliosis is a full-time brace treatment. For example, some of the scoliosis-specific exercises could help small curves. So when you happen to see somebody with a smaller curve, you can also refer them to specially trained, certified scoliosis-specific certifications. Could be SHROD, could be CIAS, could be other certifications to make sure that the person is seen by a professional and not to overlook even small curves. We have guidelines to follow when we treat scoliosis patients, and these guidelines, Scoliosis Research Society guidelines, cannot be ignored. So if you have a patient and you kind of not know about what to do with them and you keep that patient, within a year or two, you can have this progression, which is very severe scoliosis and needing spinal fusion surgery as a treatment. While back then, when the curvature was smaller, brace treatment and scoliosis-specific exercises could have helped this client. So it's important to recognize the signs and symptoms of scoliosis early and recognize the scope of practice you're running, if you're able to or not able to help these clients, if you have the knowledge or not have the knowledge, and pass these clients on to certified practitioners. This is, for example, how scoliosis-specific exercises reshaping the torso and trying to maintain muscular balance to hold the scoliotic curvature and improve the scoliotic posture. So it's important to see that this is a severe curve on the left side, coming to my office about 3 years ago. She needed brace treatment and she needed the scoliosis specific exercises to become strong and maintain a healthy posture. Now she knows how to hold her posture and she's a dancer now and she's doing her regular activities as well as some of the specific exercises to maintain her balanced posture. On this slide, I just wanted you to start thinking about how you're going to address your client's needs in the future. For example, this person, if she has this scoliosis, which is showing on the X-ray on the left side, would this exercise be beneficial for her? Would this exercise help her scoliosis or not? I'm pretty sure by now you know the answer.